It has been 5 days since the total eclipse that cut a path of temporary darkness across North America. Millions of people watched it, found it awe-inspiring. However, a good portion of them later complained of health problems, some of them real, some of them may have been imagined.
Clinical nurse specialist Alice Benjamin, aka Nurse Alice, here with some important information for us this morning. Thanks for being here.
Good morning.
Appreciate it. We know the Google searches, everybody was searching for vision changes, a lot of people searching for headaches. Those searches skyrocketed during the eclipse here. Is this hypochondria or what is this?
Well, yes, so there were millions of Google searches, and it's good that people want to be informed, you know, they're active participants, but we want to caution people because the sources on the internet, you don't know how reliable they are, and they're ultimately not your doctor. And they can also feed what we're calling post-eclipse hypochondria, so which is an anxiety disorder where you have a distorted or unrealistic perception of a medical condition, and you actually think you have this when you've never been medically diagnosed, and you might not even truly have the symptoms of the condition.
Well, you know, on Monday, we all were looking at it with our proper glasses, and afterwards we're like, do you see spots? I think I see spots. But you start to hear things, and then you start to think things. But despite people being warned, don't look at the eclipse unless you have the glasses on, people did. Especially when you're told not to do something, sometimes people, you know, want to do it. So what are some of the guidelines for folks that did take a peek without the proper glasses?
Well, there are tons of people who threw caution to the wind and did, right? And actually 50% of people don't follow doctor's orders. So is this unusual? No. A little concerning, but still, if you're someone who did throw caution to the wind and did look at it without the proper eyewear, rest assured, unless you were gazing at the eclipse for, seconds, more than 60 seconds, a minute, and on like that, or perhaps even if you had the protective eyewear, but you sat there and you gazed at it all day, want to be careful. If you are someone who's having symptoms now, still 5 days after, blurry vision, spotlights, flashing lights, we want you to make sure that you get in to see your doctor now.
What were the range of complaints? I imagine some were pretty reasonable, like maybe seeing spots, and I imagine some were pretty crazy.
Oh yes, so vision changes, we expected that. Headaches, we expected that. There were sprains and strains, right? Not directly, not directly related to it, but secondary, because people weren't paying attention to their surroundings, fell off a curb. There were actually car accidents. And some people actually complained of having the blues or even some hormonal or menstrual irregularities because of the eclipse. Now the blues piece, there might be some truth to that. It's like the last day of school. You're so excited, it's the last day, and then the day after you're like, oh, I miss my friends, kind of sad. So, tons of complaints. Did we see a spike in the emergency rooms? Yeah, we did, but a lot of those were very minor, nothing that we really needed to be so concerned about.
But we heard hospitals were staffing up, right? Getting ready for the possibility of people, injuring themselves in some way.
Right, and so we better prepared than not prepared, so we did staff up. However, it wasn't because of the vision changes or their headaches. We were concerned with the other things, like the sprains and strains and the accidents, because people weren't paying attention to their environment. And there's a lot of ER visits, almost 140 ER visits a year per the Centers of Disease Control, and about a third of those are usually injury related. So we knew that when people are going to gather for a special event, increases the likelihood that something would happen. So we were ready just in case.
Wearing dark glasses and looking up at the sky.
Accidents happen.
And then on your cell phone.
Right. For more information about clinical nurse specialist Alice Benjamin, you can follow her on social media. Check out her website as well, asknursealice.com. Thanks so much for being here.
Thank you so much.